Your dog has been a little off lately. Maybe he is sleeping more than usual. Maybe he skipped breakfast yesterday and you thought, well, he probably just is not hungry. Maybe he has been licking his left paw for 3 weeks and you figured it was just a habit. Concerned. Here is what I need you to understand right now. Dogs do not get moody. Dogs do not skip meals out of preference. Dogs do not develop habits of licking one specific spot for no reason. Every single one of those things is a signal. And the fact that it looks minor, that is not reassurance. That is the design. Serious dogs are biologically wired to hide discomfort. It kept their ancestors alive in the wild. It is working against you right now in your living room. In the next 20 minutes, I am going to show you exactly what your dog's body is communicating. And more importantly, which signals mean watch and wait, and which ones mean pick up the phone and call your vet today. Not tomorrow. Today. Stay with me. This matters more than most people realize. Before we go any further, let me be straight with you. What you are about to hear is real veterinary information drawn from clinical research and 25 years of working with animals. But it is education. It is not a diagnosis for your dog. It is not a treatment plan. Your dog is an individual. Their history, their breed, their age, all of it matters in ways a video cannot account for. What I want is for you to walk away from this conversation better prepared to recognize something worth investigating, and then take that to a qualified veterinarian who can actually examine your animal. Use this information to have a better conversation with your vet, not instead of one. Now, let us get into this. I am Dr. Amal. Over the past 25 years, I have worked with animals across clinical settings, farm environments, and emergency cases that most pet owners hope they never have to face. Small animals, large animals, I have seen the full picture. And one pattern shows up more consistently than almost any other. By the time most owners bring a dog in, genuinely worried, ready to act, the condition has already been developing for weeks, sometimes months. The signs were there. They were just quiet enough to explain away. That gap between the first signal and the moment someone takes action is where outcomes are decided. I have seen it go both ways, and I want today's conversation to make sure it goes the right way for your dog. Here is the fundamental problem with dogs and illness. They are not designed to show you weakness. This is not stubbornness. This is not a personality trait. It is evolutionary biology that runs so deep it overrides pain. In a pack environment, a dog that visibly struggles becomes a liability or a target. So the instinct to compensate, to push through, to appear functional, it is hardwired. What that means for you as an owner is this. By the time your dog is showing obvious signs of being unwell, refusing to move, crying out, visibly struggling, the condition causing that has usually been present and progressing for some time already. Research published in veterinary behavioral literature consistently confirms that dogs suppress pain responses to a significant degree. One study examining dogs with confirmed orthopedic conditions found that owners rated their dog's pain as considerably lower than the clinical assessment showed. The owners were not wrong to trust their dogs. Their dogs were just very good at masking. Think of it like an iceberg. What you see above the surface, the limp, the loss of appetite, the withdrawn behavior, is the smallest part of what is actually happening. The bulk of it has been building underneath for far longer than you knew. This is why the early signals matter so much. Not because they are dramatic, because they are the only honest window you get before the body runs out of ways to compensate. And most of those early signals look like nothing worth worrying about. That is the trap. In about 2 minutes, I am going to walk you through the biological reason dogs mask illness so effectively. And once you understand the mechanism, you will never look at a minor change in your dog the same way again. Let me explain what is actually happening inside your dog's body when something goes wrong, because this changes how you interpret everything. When a dog experiences internal stress, whether that is infection, organ dysfunction, early joint degeneration, or chronic pain, the body's first response is not to shut down. It is to compensate. The adrenal glands release cortisol. Adrenaline adjusts. The nervous system recalibrates. The dog keeps moving, keeps eating, keeps greeting you at the door. But compensation has a cost. The body is spending energy it would normally direct elsewhere, toward immune function, digestion, tissue repair, on maintaining the appearance of normal. Over time, that reserve depletes. Think of it like a car running on a spare tire. It still drives. You might not even notice from the outside. But it cannot sustain highway speed indefinitely, and when it finally gives, it gives suddenly. That sudden deterioration, the dog that was fine on Monday and is in crisis by Thursday, is almost never actually sudden. It is the end of a long compensation curve that nobody saw because the signals along the way were easy to dismiss. Here is what makes this especially important. The liver, kidneys, and heart, three of the organs most commonly involved in serious disease in dogs, have remarkable reserve capacity. The kidneys, for example, do not typically produce detectable clinical signs until roughly 65 to 75% of their functional tissue has already been lost. That is an established finding in veterinary nephrology. By the time your dog is showing textbook kidney disease symptoms, the condition has been progressing for a significant period. The same principle applies to cardiac disease. Research from veterinary cardiology studies indicates that many dogs with early-stage mitral valve disease, the most common heart condition in dogs, show no outward symptoms for months to years before the condition advances. This is not meant to alarm you. It is meant to recalibrate your baseline. A dog that seems mostly fine is not the same as a dog that is fine. In about 2 minutes, I am going to show you the specific observable signs, the ones that are easy to explain away, that your dog's body uses to tell you the compensation is starting to crack. I am going to give you these signs in 2 categories. The first category, monitor and investigate. These are signs that warrant a veterinary conversation at your next appointment, or sooner if they persist or worsen. The second category, act today. These require a same-day call to your vet. No waiting. If your dog is drinking noticeably more or less than their normal pattern, and you know what their normal pattern looks like, that is worth tracking. Increased thirst is associated with kidney disease, diabetes, Cushing's disease, and several other conditions. Not one of those conditions announces itself loudly at the start. One low day is nothing. 3 consecutive days of a dog that is slower to rise, less interested in play, or sleeping in positions they do not usually choose, that is a pattern worth noting. Do not explain it away as aging until aging has been confirmed as the cause. Occasional grass eating is generally considered normal. Consistent grass eating followed by vomiting, especially in the morning on an empty stomach, can indicate gastric discomfort or acid-related issues that have a treatable underlying cause. Not general grooming, one spot, left paw, base of tail, one side of the abdomen. Localized, repetitive licking is the dog's equivalent of pointing at something. The cause may be superficial, allergies, a splinter, a hot spot, or it may indicate referred pain from a deeper structure. Either way, it is a signal, not a habit. Your dog stops halfway up the stairs and pauses before continuing. They sit down slightly differently than they used to. They are reluctant to jump onto the couch they have used every night for 3 years. These are not personality changes. These are compensations for discomfort in joints, muscles, or the spine. If your dog is breathing faster than normal while lying down, not after exercise, not in heat, call your vet now. Respiratory changes at rest are among the most serious signals in veterinary medicine, especially in large and deep-chested breeds. Gastric dilatation volvulus, bloat, is a life-threatening emergency with a narrow intervention window. Do not wait. No observation period. Immediate veterinary contact. Healthy dog gums are pink and moist. Pale gums indicate inadequate circulation or oxygenation. This is an emergency. The gap between the first category and the second is why early recognition matters. Catching a change in water consumption is a manageable conversation with your vet. Catching pale gums is a race against time. The most common mistake is also the most understandable one. Pet owners wait for their dog to tell them something is seriously wrong. And because dogs are so effective at not telling you that, the wait goes on too long. The second mistake is attributing change to age without confirmation. I hear this regularly. He is slowing down, but he is getting older. Age is a real factor. Age is also the most convenient explanation for a symptom that deserves investigation. Slowing down, drinking more, sleeping longer, losing muscle. These things happen with age. They also happen with hypothyroidism, kidney disease, arthritis, cardiac conditions, and dental pain. The only way to know which one you are dealing with is a veterinary examination and appropriate blood work. Assuming it is age does not make it age. The third mistake, and this one genuinely surprises people, is avoiding the vet because the dog does not seem to be in pain. Pain tolerance is not a measure of health status. A dog with early liver disease does not experience dramatic pain. A dog with significant dental disease often eats normally right up until they cannot. Absence of obvious pain does not mean absence of disease. Most people do not know this. That is not their fault. But now you do. Do this now, before anything seems wrong. Know their normal water intake. Know how long they typically sleep. Know their normal appetite, their normal gait, their normal weight. When something changes, you need a reference point. Without one, you are guessing. Run your hands along your dog's body from nose to tail once a month. You are feeling for lumps, asymmetry, areas of heat, or spots where your dog reacts to being touched. You are not diagnosing anything. You are noticing change. Any new lump that persists beyond 2 to 3 weeks deserves a veterinary opinion regardless of size. Once a week, press your finger against the gum above the upper teeth, release, and watch the color return. It should return to pink within 2 seconds. Pale color or slow return is worth reporting. This takes 10 seconds and costs nothing. When you notice something, write it down with the date. A single observation is anecdote. 3 observations over 2 weeks is a pattern. That pattern is what your vet needs to make an informed assessment. He has been a bit off lately, helps nobody. He has drunk noticeably more water for 12 days, skipped 1 meal, and is slower on stairs, is useful clinical information. If your dog is 7 years or older, regardless of breed, ask about annual wellness blood work that includes kidney values, liver enzymes, thyroid function, and a complete blood count. These panels are one of the most practical early detection tools available and are widely recommended in veterinary preventive medicine guidelines. If something is different about your dog, behavior, appetite, movement, coat, water intake, and it has lasted more than 3 days without a clear reason, call your vet. You do not need to have a diagnosis to make that call. You just need to have noticed something. That is enough. Let me give you the short version of what we covered today. Dogs are biologically built to hide illness. That is not a flaw. It is survival instinct working exactly as designed. But it means the obvious signs you are waiting for are often the last signs to appear, not the first. The organs most involved in serious disease, kidneys, liver, heart, have significant reserve capacity. Conditions can progress substantially before anything visible surfaces. By the time the signs are hard to miss, the window for the easiest intervention has often already passed. The early signals are quiet. A change in water intake, a shift in energy, localized licking, a new reluctance on the stairs. These are not nothing. These are the only honest communication your dog can offer before the compensation runs out. Know your dog's normal. Notice change. Track it. Report it. And please, take what you learned today into a conversation with your own veterinarian. That is exactly what this information is for. Before you go, I want to ask you something specific. Think about your dog right now. Is there one thing, just one, that has been slightly different lately that you have been explaining away? Leave it in the comments below. You do not need to have an answer. Just name it. Sometimes writing it down is the first step to taking it seriously. Next week on PawMD, we are covering something that affects an enormous number of dogs and gets misdiagnosed constantly: chronic ear infections. Not the surface level advice, the actual mechanism, why they keep coming back, what is really driving them, And what questions to ask your vet that most owners never think to raise. If today's video gave you something useful, something that made you look at your dog a little differently, subscribe to PawMD, hit the bell. Every week we have this conversation, real information, no padding, no guessing. I am Dr. Amal. Look after your animals. They are counting on you.